We're not in the weight loss industry, we're in the fat loss industry. And until we can accurately look at somebody's complete body composition, not just how much they weigh by stepping on a scale, and how we can really look at what kind of energy somebody is burning during exercise, it's impossible for us to really accomplish ideal body composition. So when somebody comes to us for a metabolic test, we're able to give them those numbers, and we give somebody a complete body composition analysis. So we're not just looking at weight, but we're looking at what is their percent body fat, what is their lean mass, their muscle on their body. And then with the metabolic test, we can really give somebody a prescription to where they're burning fat efficiently during exercise. So whether it's a spin bike or a treadmill or a stationary bike, we can give them 100% accurate results in terms of where is their body most efficient at burning fat during exercise. So we take them through a graded exercise test, meaning starting at a really moderate level and taking them all the way up to their threshold. And how do we really give them a prescription for success? And so through the course of the test, we're gradually taking them up to their threshold, and from that we can see where are their heart rate zones, and in those heart rate zones, not only how efficient are they at utilizing fat for energy, but also how do they maintain their lean muscle. So when we're training, we're not just training so high in intensities that are burning calories, but we're burning muscle in terms of calories. So how do we maintain lean muscle? How do we burn fat? And also, how many calories do we need to be fueling our body with so that the energy that we are using during exercise is getting replaced efficiently? So our metabolic assessment allows us to give a client all that information so that when they walk away, they have a complete, accurate assessment, an accurate prescription for success, including this is how many calories I need to eat on rest days and exercise days. This is my heart rate training prescription in terms of low intensity days. I need to be staying in these zones. On my high intensity days and pushing my thresholds, I can train up to X percent of heart rate so that I'm never going past my threshold. That's the point at which we're really worried about losing muscle tissue. So, we really feel like we can give somebody a full plan of action so that when they walk away, they know how many calories they need to eat, what the breakdown is of those nutrients like proteins and fats and carbohydrates, and in addition to that, where do we need to be training. And we request that every client get a heart rate monitor so that they can really look at and monitor if they're staying in those zones, and that's really where and how we know that they're going to get the best results, and that we feel like we have the science finally to give somebody that information. The science is there, why not use it? And we feel like we're able to do that instead of guessing.